A lot have been mentioned by all the speakers since I came in, and I want to appreciate a lot of work that goes into cancer prevention and control, which is the mandate of the National Cancer Institute of Kenya. And I really want to thank Dr. Njuguna for sharing her presentation, because a lot of information she shared are legal and policy provisions that gives us reason every day to work with my team within the Institute and those whom we partner with. The National Cancer Institute of Kenya is an agency under the Ministry of Health. It is a government institution, and this institution was established by an act of parliament, one of the many that she mentioned, Cancer Prevention and Control of 2012, and we now have Cancer Regulations 2024 to make sure that we have regulations, we have policy, we have legal instruments that guide specifically on how we want to address the burden of cancer in our country. We are in existence to use a multi-sectoral approach to address the burden of cancer in our country. And what we do in our country, since we are a global village, we have to relate with what the globe does. And we have to relate to what the region does, as well as what our country and our counties, which are the smaller, geographical units within our country. We have this national umbrella that then provides leadership in cancer response using a multi-sectoral approach. And I always like what Madam Benda says, that we should point all arrows forward. All of us should be doing the same thing, working together as a team. And I invite all of us today to join us in that mission. I just want to mention that one of the functions of the National Cancer Institute of Kenya is we are the custodians of our national cancer registries. And therefore, as we look at all this data, which they are estimates from globally, but we have very mature high-impact cancer registries in our country that informs what data is estimated from our country, which are both population-based registries and also the hospital-based registries. And we are now working towards setting up childhood cancer registries and pathology registries and even tumor genetic registries. We all know that from what you've discussed, that cancer is caused by many, causes. Among them are infections. And we all know, if we have such literature very well, that infections causes a part of these cancers. It worries us whenever you hear about, when I sit in the clinic seeing patients, that one question patients will ask is, will I be cured of this cancer? Because at that time, the disease has been diagnosed. We do not have an opportunity to discuss about prevention. One of our functions at the National Cancer Institute of Kenya is public education and awareness, which really takes care of prevention aspects. But once the diagnosis has been made, it is now about, will I be cured of this disease? That is a billion-dollar question, which many times there is no straight answer from any oncologist that yes, you will be cured. Because we know there are many factors that influences prognosis. Why do many of our patients die in our country? We look at low screening rates, limited access to screening and treatment, HPV vaccinations are still low, the uptake is still low, lack of awareness, and socioeconomic factors. In our country, from our National Cancer Registry, we have data drawn from institutions that treat cancer across the country, and the distribution is very different. Geographically, which then means we have different risk factors. While we are still struggling to appreciate that, cancer statistics or incidences vary from regions to regions globally, we are now recognizing also that within our country, we are also different. Those of us who reside in the western part of the country have different risk factors compared to those who are in the northern part of the country, and it's because of genetics and epigenetics that surrounds, that influences why cancer is caused, and of course risk factors as well. They do vary. I'm very happy that we are discussing about implementation science. A lot of times we have participated in different forms of research, but if it cannot translate to a difference, if all this data that we are generating from our different researches, whether it's basic, whether it's clinical trials, whether it's policy-related research, if it does not change, if we don't see any difference, then we will have invested in vain. I have one job serving at the National Cancer Institute of Kenya, reduce the burden of cancer. If my term comes to an end and the trends of cancer are rising, then I will not have delivered. So I want to ask us, even as we sit here today, work with me. And when I talk about me, I'm talking about the National Cancer Institute of Kenya. So that even when I'm not here tomorrow, when someone else is serving in the same office, we continue with the same agenda to make sure that all these women who are diagnosed with cervical cancer, the more than 6,000 every year, can we diagnose none? Or, if unfortunately, because of factors that it's inevitable, we may diagnose them. Can we diagnose them early? Can we treat them with good outcomes? Because I do believe that as a country, we suffer one of the biggest burdens of cervical cancer in the world. Yet it's a preventable disease and it's a curable disease. We have so many policies that we are trying to enact as a country to support the work that we are doing. We have doing resource mobilization domestically and internationally. Without resources, we are not going to achieve anything. I am all the time reaching out to our funding opportunities within the country, including from the taxpayers' money, so that we can use these resources in cancer prevention and control across the entire continuum of care. And our priority areas of investment are low-hanging fruits, and this includes cervical cancer and a few others: breast cancer, prostate cancer, and colorectal cancer. We don't have as much lung cancer in Kenya as it is in other regions globally. Of course, every country right now, if you are not able to conduct research, then you cannot audit what you are doing. You cannot do quality improvements in the investments that you are having. So it's important that we all invest in research, and I want to appreciate the efforts by MKU and our other stakeholders that are involved in research in cancer care. The policy documents within our Ministry of Health that are specific to cancer, we begin with, the plan. Serving in a government agency, every administration leadership of every country has their priorities. And in Kenya, we have the plan, which is bottom-up economic transformation agenda for our country. And in there are 5 priorities. One of them is universal health coverage. And universal health coverage, in there is a lot of reforms towards making sure that any patient is prevented from cancer and any patient is treated if diagnosed with cancer and treated with good outcomes.